Medicine is constantly evolving, and we do things very differently now than we did in many instances 20 or even 10 years ago. For instance, we used to recommend bed rest following heart attacks or major surgery, or we used to give antibiotics for colds. Nowadays we don't do that, and the evidence-based intervention programme is just part of this evolving process.
The evidence-based interventions programme is absolutely about improving the quality of care for patients. But we all have a duty to use public funding, taxpayers' money, wisely. And by limiting or reducing procedures where we know there is no longer the evidence to support them, it means we can use precious resource to do other things where there is an evidence base.
I think it is very true that medicine progresses and evolves, and it is one of our duties as professionals to ensure that we are up to date with those changes and evolutions of care. It is also perhaps one of our professional duties to explain and communicate to patients why treatments have evolved and in what way they've evolved, and how those improvements will make a difference to them and their health.
NHS Clinical Commissioners represents the bodies that purchase services for patients in their locality. EBI is very important because it helps us direct those NHS funds appropriately and purchase services that are effective for our patients. This is not about cutting care, it's about making sure we spend the NHS pound effectively. So we spend the money on the services that are best for our patients, giving the best outcomes, and don't waste the money on products we think are not effective.
I appreciate the fact that patients are able to talk openly to their GPs and to discuss their conditions and to reach shared conclusion and way forward. I think that's really healthy.
I represent NICE, and our role is to issue evidence-based guidance to the health and care system to improve care for patients. And we support the evidence-based interventions programme because in many cases that has drawn on NICE guidance, and because it helps to improve standardisation and fairness across the system.
I think there's a number of reasons why GPs have supported this programme. Partly it's about helping difficult conversations. Partly it's just about having an evidence-based resource about what works and what doesn't work, and probably more importantly what the alternatives are. It's partly about that. But it's also partly about the kind of wider sphere of how we have to rethink clinical practice. In the past, I think doctors have been very enamoured with medical interventions, and we've assumed that what we're told works actually does work. Increasingly, there's very strong evidence that some of the things that we held dear really aren't effective. Sometimes are very expensive and sometimes are unsafe as well. So having better evidence presented to us in an accessible way is extremely helpful for frontline clinicians.
Doctors are overwhelmingly supportive, and this is because it means that patients are going to get the best care. But it also means that for every pound spent on healthcare, it's going to be spent more wisely.